Good morning. It's great to be back in Pinellas County. I want to thank Tommy and Senia from Baycare, Lou Galdieri, also here from Morton Plant, for all their hard work over the past many months. Today's exciting day in terms of rolling out something new that is, I think, going to make a real difference in terms of the coronavirus response, and particularly for our most vulnerable populations. So yesterday, the president announced that the federal government had procured 150 million of these new rapid antigen tests, COVID diagnostic antigen tests. They basically bought all of Abbott's Labs inventory, and so they're going to apportion it to the states on population. They are going to send it to all nursing homes and long-term care facilities, a lot of them, and then they're going to send the state of Florida 6.4 million on top of that. And so we're going to discuss a little bit what we're going to do with that. But first, we're going to demo this and just show you. By the time I finish my remarks, we'll have a result. And so the good thing about this is you do not need a lab to do it. You see, we have a nurse here. Everything comes in this box. There's, I think, about 40 of these cards. They have the reagent there. They have the swabs. It is a swab that goes in both nostrils, but it's not one of the swabs that really kind of gets up in like your brain where you feel like, oh my gosh, this is really bad. So much more pleasant than the typical swab that they're using for the standard PCR tests. And that's I think, is that the reagent? Yeah, putting in the reagent. And then all the stuff's right there. So if like a senior center were to get one couple of these, they pretty much don't need anything else than what's already in the box, locked and loaded and ready to go. So it'll be about 15 minutes, but really, most of the results, if it's positive, it usually pops pretty quickly, so you'll be able to see it. It really is akin almost to like, lighting the thing like almost like a pregnancy test in some respects. So this is really, really significant because when we're looking at protecting the folks who are most vulnerable, particularly our elderly population. I've showed the CDC numbers that they put out, and if you look, it's really dramatic. The under 50, you're 99.98%. If you get infected, you're going to survive, or even better. And then it really goes up dramatically once you hit that 70 plus. And so this is really the demographic that we've worked really hard with in terms of our long-term care facilities, our nursing homes. Jared's done a really good job in getting a lot of resources. We've done probably, 10, 15 million masks and 15 million masks, face shields for the staff of the long-term care facilities. We're also, we did very early on, one of the first states to test all the residents and test the staff members. And then once we went through everything once, we started doing bi-weekly testing, and we're able to do that. That bi-weekly testing was good because they could self-swab, and then we had it sent to a lab that would turn it around pretty quickly. The problem with some of these other tests is, you really need them to be administered. This one, it does need to be administered by a nurse. So I think one of the things we're going to have to figure out is some of these nursing facilities, obviously they have that. But some of the other places we want to go, they may not necessarily have someone on staff. Is there a way to get what's called a CLIA waiver to allow some other folks to be able to administer? Because you see, you can do it. So I think this is going to be really, really significant. So if you think about 6.4 million tests, that is, I don't even know that we could physically do that many tests. There's certainly not demand for that many tests right now. We have capacity just in our drive-through sites that's not even close to being utilized due to just lack of demand. Look, there's not as much virus. That's a good thing. So we're gonna, we do want to figure out how you can do it. So that's going to be one thing we're going to do. But what we're going to be doing is not just nursing homes, not just long-term care facilities, but we are going to have priority for any senior center, any retirement community. If there are some additional long-term care that didn't get the federal shipment, then we would be looking to do that as well, but HHS is shipping that directly. In fact, I think 800 of these facilities in Florida have already gotten this. Even as we speak, they have it right now. Florida, we're going to get our shipment to the state probably by the end of the week. So we want to be able to do that. So you're thinking not just the nursing home that may be here in Pinellas County, you're thinking like Sun City Center over in Hillsborough County. You're thinking other types of senior dominated facilities. That is going to be good. And the thing you come back to is, we talk about protecting the people that are most vulnerable. That cannot mean that you just isolate vulnerable people and not let them also enjoy life. And so we thought long and hard about that with the visitation for the nursing homes. So we introduced that over a month ago. I'm pleased to say the infections in nursing homes have declined dramatically. It's probably a reflection of the decline in the community. But being able to give those folks the ability to reunite and be there in person with family members is a huge part of health. It's a huge part of why these folks enjoy life and want to do that. So it's really, really significant that as we're doing these tests, we're not just going to do them. And quite frankly, we built a huge apparatus here in Florida, but it was basically just, hey, anyone wants to test. Wasn't always necessarily a method. I think there's going to be a good method to it. Obviously, you use it to try to identify infection, particularly in congregate living environments. Going to be very important. But I think you can also use it so that folks who may be more vulnerable are able to enjoy life to the fullest. So, for example, if you have a senior who would like to have younger family members come, these will be available. I mean, this is a 15-minute deal. You can do that. So it really lets people, I think, do more and really be a part of life. And I think the response has got to recognize that component. We did it with the visitation. I think these tests, that will also be a component. Just think you could have different senior events where if you want to test, you could even test a group of people who are going to get together if you wanted to be safe and have the ability to do it. So I'm excited about that. We also, the other priority after the vulnerable population is going to be for schools. So if you have somebody, a kid, a student that has symptoms, obviously they're going to be pulled out of class. Right now, we're in a situation where they would likely be isolated. They would get a test, it gets sent away to a lab, and there's some lag time. The problem with that is, well, one, we want the student and the parent to know as soon as possible, but two, some schools are isolating people that may have been in contact. So these are people who are not showing symptoms, and a lot of the parents have been frustrated, I think rightfully so. What I think this does is, if you have that student who starts developing symptoms, they can be obviously taken out, they can be given this test, and then we'll know within 15 minutes whether it's COVID or not. If it's not COVID, then you should not, by any means, isolate any healthy students. Now, I personally think that the isolation there, I think a lot of school districts are doing good. I know there have been some that did a lot. And I think that they just be as targeted as possible. But I think this will be really good for that. And so this way, because kids get sick for a whole bunch of other things except coronavirus. In fact, I mean, you're going to see a lot of traditional seasonal illnesses that they do and pass, and things are going to be fine. But we do want people to know, and we don't want to send people home before we can. So this is, I think, really, really important. And I'm excited when the White House was asking me, how do you want this done? Do you want us to just, you tell us where to send it and then we'll do it, or do you guys just want to get the shipment to you and then you do it? And I thought about it, and because they're already doing the long-term care, that's a huge component of what we would do. But I was like, I think that it's probably the best to work out of Jared's operation, because they do this every day with the logistics. This is basically, they do it every day. And so we'll be able to get it to where I think it needs to go. So focusing on all seniors and then focusing on schools. But if you put it in perspective, we're going to be getting 400,000 of these tests a week. Now, we have had some positive corona tests in schools, but it's been a very, very small. There have been some students who have been isolated who were exposed, but even that, while a larger number than the positive test, is still a very small percentage. So you're talking about if each school district had a few thousand of these, that's probably going to be enough to be able to last them for a long time. But of course, we're going to keep getting 400,000 every single week going forward. So this is going to be good. I think it's also going to save the state a lot of money. We spend, now granted, we use CARES Act dollars or we apply for FEMA reimbursement, so it's not like it all just comes straight out of general revenue, but it's $100 a test at a minimum. Some of the tests are more, right, or some of the antigen tests. So $100 a test at a minimum. And if you think about, today I think we reported 70,000 tests, 75,000. At the height, we were doing 100, 120,000 pretty every day. Now, state's not paying for all those. These guys here at Baycare do tests, all the hospitals, that's a big part of it too. But I mean, it's a lot of money. So these are ours. And we'll give them, and there's not gonna be any cost to this. You just do it, you get the result. Do we have a result here yet, or is it not?
Yes, sir. And it's negative.
Negative, yay. Thank you. He wouldn't have been able to get on the plane going back if he was positive, so it's good to see that. So this is good. So we're going to be able to do it, and I think Jared is going to really be able to get it where it needs to go. So this is the technology. I mean, if you look back to February, well, actually January, we started monitoring. There were people coming from China that the Department of Health was monitoring, and sometimes they do a test if there was a symptom. But these tests would have to go, actually the CDC, they didn't even remember the test, there was problems with that. Once that got resolved, you'd send it to Atlanta, wait 6 days, and then this, and then everyone's trying to find swabs and all these things. We were trying to find all this stuff as much as a huge rush on it. Then as we got into like May, we built a big infrastructure, we were going. But then in June, July, when there was a lot of people testing all across the Sun Belt, the labs got backed up. So you'd go and test. Sometimes you'd get a result in 3 days, 5 days, 7 days. And that's just, it was not optimal. Now, there have been some other rapid tests, but I don't think anyone that's going to be this convenient. And so we went from, in January, not even having a test available in the United States to now having one that basically I could fit this in my pocket, take it out, and it can be used, and you get a result, usually less than 15 minutes. So this is really, really good. And I think it's going to be really important to continue for protection of the senior community. That is not just from Corona, but being able to give them confidence and be able to protect if they want to do things with family or do other things. I think I don't know that when we saw the nursing home numbers go down after we allowed visitation, a lot of people were concerned that that may cause a spike. And look, it may have just been correlation, but I do think that the fact that you have some of the people that really care about them back in the facilities, I think that's actually a bonus for infection control, because I think they're looking to make sure things are going well. I think everyone performs better when you have those folks in there, and I think it's really, really been positive for people's psyche and mental well-being. And so I think this can help us with the similar functions by really potentially allowing for more family interaction than some have been comfortable with. But I mean, I'm comfortable with my kids and my mom and everything, but not everyone is, and so you have that, and I think that that's a really good thing. So where we're at now is today our ICU COVID positive patients are down 73% from the July peak. We have daily hospital admissions are down 82% since peaking on July 14th. The ED visits for COVID-like illness have declined by about 80% since the peak July 7th through the 14th. And you're seeing that's pretty consistent across the entire Sun Belt. If you see, the EDs went up, and then they've all kind of gone down from Arizona to Texas to Georgia to Florida. And I think the percentage of visits to the ED that are COVID, I think is around 2% throughout the Sun Belt, which is maybe even under 2% now. We're basically at levels like we were, I think, with the ED visits in May, and then right as the pandemic was getting started in March. And so we hope that that continues, but that's a really key indicator. You know, these tests, like in Pinellas County, the tests are overwhelmingly coming back negative. I think Pinellas County hasn't been above 5% in a long time, or certainly above 6%, and they're usually 3 or 4%, and that's been pretty consistent. You've seen massive decline in hospitalizations for COVID and admissions for COVID, and the ED visits as well. One of the things I was talking to Tommy about is the ED visits for other things still haven't recovered to where they need to be. Like, people are still going to have heart and stroke symptoms. That's not going away, but there has been a fear for coming in to seek care. It's not as pronounced. Would you say it's not as pronounced as March and April? So more people are comfortable, just not where it needs to be. Is that fair? Yeah. So we, at the department, we're asking our Department of Health, and we're really going to push, full spectrum health, corona, particularly for those who are most vulnerable, but also if you have these symptoms of heart, stroke, these hospitals are safe. They've got abundant capacity. I mean, I looked at the census today in different counties. I mean, I think Miami-Dade is like 35% of their beds are empty. It's like 26 or 2,700 beds that are just empty. So we want people to be doing that, because putting that off is really going to be detrimental. And the same thing for some of the screenings. I mean, you guys probably fell behind in cancer screenings and some of those things. I know some of that's starting to recover, but we need more people to be comfortable. They do a better job here with infection control than anywhere. I mean, you're better off coming here than just going just about any other place. So please come in if you do it. Also, we still have a deficit in immunizations for children. That's something that's very significant. And I mean, if it's a fear of corona that's causing not to get immunized, just understand, I showed the chart, some of the kids are going to be more susceptible to some of these other things that you get the vaccinations for. So please do that. We think it's very important. And then also mental health. This has been something that the CDC has said 18 to 24, seen a 25% increase in depression. Since the mitigation started with the pandemic, and we're really sensitive to that. So all of these things are important in terms of health, but we're definitely pleased to see much lower hospitalizations, and our hospital capacity is robust and abundant. Even at the peak with coronavirus patients, I think we probably reached maybe about 13 or 14% of the total licensed beds had corona. Now we're about 3%, 3 to 4% of all licensed beds have a corona patient. So the vast majority of beds are being used for the traditional illnesses, and a lot of them are empty. So we want to make sure folks are utilizing that as best they can. So I'm just excited that we're able to do this. I remember talking with the White House. They said they may be able to get these here. Then we thought, well, maybe not till later in October. I'm like, man, it sure would be good to have it right now. And so when we got the word, I got the word on Sunday that we'd be getting these very soon, and to see they've already arrived at a lot of these nursing homes and long-term care facilities is great. So I'm going to let Jared Moskowitz come up and talk a little bit more about how this all is going to work.
Governor, thank you. Senator, Representative, it's good to be with you today. From day one, the division under the governor's instruction has been extremely aggressive to make sure that we had the resources we need. Little we forget, when this whole thing started, there were no COVID tests, and we went out and procured COVID tests to make sure that we were able to get testing off the ground and running. Then there were no swabs to collect the sample, and we were aggressive to make sure that we would have the swabs needed to go along with those tests. We opened up 60-plus state testing sites and did 1.6 million tests at those sites. We ran one of the largest testing logistics operations in the country in our long-term care facilities by doing 1.2 million tests in those long-term care facilities alone, testing staff over the last 90 days. During the spike happened, we'd made sure that hospitals like Baycare had the resources they need, and provided almost 2,500 medical personnel into our hospitals. And the division has distributed 69 million masks, 22 million gloves, 7 million gowns, 2 million face shields, and 1.2 million shoe covers. And so we've always tried to be at the forefront of whatever the next technology is. And so when rapid testing came available, we put that out there. When antigen came available, we put that out there. And so when this test was announced, we wanted to make sure that we were at the forefront. And so we were all, the governor and myself were on the phone with Abbott, trying to make sure that Florida could be one of the first to get these tests. And so, but the federal government bought the entire year's supply. So we were happy about that, obviously, because now we get them for free. So it's even a better scenario. And so we will do our part to make sure that this gets out as fast as possible, just as the division has done that with reimbursement dollars, over $3 billion out back to cities, counties, hospitals, houses of worship, $750 million since COVID began. We'll make sure that there's no delay getting these to nursing homes and ALFs and senior centers like the Villages or your Century Village or your Kings Points, your John Knox Villages, to make sure that seniors have testings. And we'll work with the school boards to make sure that we can get these to them as well. In our conversations with HHS, we expect 420,000 of these to be here by Friday. And so we'll work through the weekend getting those deployed as fast as possible. And as we get more of these, we'll even look at supplanting PCR testing at some of our sites and using the rapid tests, because I have a feeling that the general public is not going to want to wait several days. They're going to want results as fast as possible, and that will reduce our costs dramatically. Over 75% of our costs at our state sites could be reduced by not having instrumentation, not having labs having to run the tests. And so, we'll make sure that we do it expeditiously. And the division is also preparing to make sure that we are ready, whether that's in October or November or thereafter, to get out a safe and effective vaccine. Early in June, we went out and purchased 5 million syringes, 5 million Band-Aids, 5 million alcohol swabs, so that we would be ready to avoid what all the states went through when they were all competing with themselves to get PPE. We wanted to make sure that we were not going to have that problem. So this is an exciting day. I said that this was a game changer when this test was announced. I still think it is that game changer, and we look forward to getting it out to the community. Thank you, Governor.
And it's, I've had it administered to me a couple times, just because anytime you are with the president, they make you take the test, much to my chagrin. I try to tell them, I'm like, you guys are saying don't test asymptomatic people, and then you're making an asymptomatic person do, but nevertheless. But it's, I think, probably the best test that I've done of any of them. I have had the regular PCR they've done. I have had the iBet ID now, which is similar in terms of how they're doing it. But I think this one is the best, and I do think, as Jared said, we can probably displace a lot of this lab testing that's being done. I mean, I think the hospitals have their labs, they'll still do it, but from the state's perspective, if we have an abundance of these things, we're going to put these out so that people are able to get a quicker result. So all in all, I think it's good. I think it's going to really contribute to our efforts as we continue to work to protect the most vulnerable to COVID, but also making sure kids are in school and making sure folks are able to learn safely and not have healthy kids get sent home unnecessarily. So all in all, a really good tool for us. Any questions? Yes, ma'am.
I have a couple questions, Governor, not to say the WFO. First, in the past, you had expressed some concern about rapid tests. Do you know what the percentage of tests come back not accurate?
I'm not sure, but the one I had a concern about was this Cepheid test that we had and we would do, and it was, and I think it was just the cycle threshold was so high that it had about a 5% false positive rate. That was a big problem, because if you get a false positive, you may be asked to isolate. In fact, we were using that and sometimes on nursing homes. If a resident tested positive, we were making them isolate, and usually either at some of our COVID-only facilities or even get sent to the hospital. So I thought that was problematic. So I think that this one is going to be truer, that if you're positive, you're positive. I don't think it's going to have a lot of false positives.
And Dr. Fauci said that lifting all restaurant restrictions, you're asking for trouble. Are you?
So I think it's important to know, we've had restaurants open the whole time. Now, obviously, we had a 50% capacity, but I think that they did a really good job in the contact tracing. We didn't really see huge amounts of restaurants. I know the CDC has put some out stuff about other states. They did like 300 people they looked at and said, oh, well, some of them had been to a restaurant, even though a lot of them had a close family member that had COVID. They probably more likely got it at home. So, but I think the industry has had to really reimagine itself in terms of how you approach this. And if you go into these restaurants, they're doing things that was never required by any type of regulation. And so what we said was, okay, you can't close the restaurant like some counties did. You can't do it. And we actually saw a result. I mean, Miami-Dade closed, I think, at the beginning of July when everything was surging. Broward did not. They kept it. And basically, the epidemics were indistinguishable. In fact, Broward probably went down sooner. So we have to look at that. So then the question is, you got to allow them to open. They have to be at least 50, and they can go up to 100. So it's really up to the locals how they want to do it. But I'm confident that these restaurants want to have safe environments. And I'm also confident that as a consumer, if you go and you're seeing something that you don't think they're taking precautions, then obviously you're going to be able to take your business elsewhere. So they have an incentive to do it, and we've also given flexibility to the locals to be able to fashion that as they want. So for example, Miami's going to remain at 50%. Some other places are going to do more. But what I would hear from people is, look, we can do 100% and do 6 feet distance. So the 50% was kind of rigid for some of them. And so I think it makes sense to say, if you could do all your seating and you still have this distance, then that obviously is something that we would want. You're already seeing more people be hired back, I think, as a result of having this pathway for them to operate. Now, it is going to make outdoor dining is going to be a little better as the weather's gotten better. It was tough over the summer. It was just so hot. People, unless you're right on the water, a lot of people don't want to do that. So I think you'll also see more of that as well. And I think that that's really, really important. So I really believe you can do things safely, and telling people no, that they can't earn a living, I don't think it's something that we want to do. I think we want people to be able to earn a living, and I think we want them to operate safely.
Governor Brad Davis from ABC in Tampa, can you help define who would administer the test, such as in school? Does it have to be a school nurse? Can it be a clerical person? Family members on family members? Can you help define that? Yeah, so that was I had alluded to that about this idea of, so what they did is they do this through this process called CLIA. So these labs get CLIA certified, and so you need to have somebody like a nurse who would be considered CLIA certified. So in that situation, you could have an elementary school. They may not have a nurse there, so how would they do it? So that's why we're going to ask for a CLIA waiver to be able to allow some of the staff who may be in a school or in a senior facility. There's no reason why you couldn't just have this at the front office of a senior facility and have someone do it. So that's what we would like to get to. If it has to be a nurse, it's just going to make it a little bit more cumbersome for the schools and for from the senior communities. Now, some of these senior communities, they're obviously going to have access to nurses. That's not going to be a problem. But others are not. So we're working on trying to get that waiver and doing it. I think that would make it smooth. As you saw, this is not, you do the reagent, you do the swab, you put it in, and do it. You can train someone to do this in about 15 minutes. So we're hoping we were able to do that, and then I think that'll really allow it to be a true force multiplier.
Governor, Tracy McManus with the Tampa Bay Times. In the event that we do see a resurgence of cases as we move forward in phase 3 of reopening, two parts. One is, what volume of cases would the state need to hit in order for you to consider more government regulations? And two, what kind of measures would be on the table, like closures or business regulations? So
the cases is not the best metric, and it's not a metric that we drive with. We look at the ED visits for COVID-like illness. We look at the hospitalizations. I think those are probably the best. It may be a challenge. Do you think there's going to be an issue when we get into flu season with knowing whether to count it as CLI or ILI? You think they'll be able to distinguish? So that's really it. The problem with the cases is you go test all these college kids, and they're saying, oh, there's a surge in Alabama, there's a surge here. Well, none of them were hospitalized. I don't even think, I think 2 were hospitalized at a 60,000. Brown University did a study on it. And so you have a lot of cases that are being found, but it's not really indicative of a raging epidemic, and a lot of it's close there. So I think the cases are not, and I would commend you to look at Sunetra Gupta, who's probably the best epidemiologist in the world from Oxford University. And she says cases are not, it's a function of how much you're testing, it's a function of how many asymptomatics, and so focusing more on the clinical, I think is the way to go. So we'll be looking at that and continuing to monitor it, but there's not going to be any type of closure of Florida. I think what we saw, if you go back to the beginning of July, there was a lot of consternation, there's a lot of fear. We were seeing, it just wasn't us, the whole Sun Belt saw the same surge. And there were calls to shut down the state, and I resisted that because I knew the devastation that would happen for that. And so the infections peaked at the beginning of July. The cases peaked a little later because there's a reporting lag. The ED visits peaked on July 7th through, I think, the 14th. Hospitalizations on the 21st. Disney reopened right after infections peaked. We had youth sports going on. We had K through 12 back in starting in August. Colleges and universities back on campus. We've had football games, high school, college. We had NASCAR, had 30,000 people. So we had all this going on, and then have still seen these big declines in the hospitalizations and the COVID-like illness. And so I think it shows that you have to keep society going. That, by the way, before March, that was pandemic 101. The idea that you would close society was not something that people thought should be contemplated, and that was kind of basic, the way you would do it. So we're going to keep doing that. We want people in school, we want people in college, obviously we want people to work, and really focus on shielding the vulnerable from infections, which I think is something that's important. And it just shows you, these colleges all across the country that saw all these, quote, cases, you saw no increase in CLI, and you saw no increase in hospitalizations. And so that's why those are better metrics to be looking at than to look at purely the number of cases. And oh, by the way, I think the antigen tests, I think, are better, because I think when you test positive on an antigen test, you have live virus. I mean, there's a good, you can say that. These PCR tests are so sensitive at 40 cycle thresholds that they can pick up dead virus for up to 3 months per CDC. And so you have some of these folks, particularly when you've had an outbreak. So like in July, you may have been infected, maybe you're asymptomatic, then you go to college and they ask you to test at the beginning of September. You could test positive from that July infection. So I think these are going to be more accurate. I think it'll have less false positives, and I think that will be good as well. Yes, ma'am.
Question?
Governor, about a month ago, you and I spoke about the school report that was accidentally released. We spoke a day after that happened. You said you would like to see a school report released.
But even like
you wanted asymptomatic and symptomatic cases. You wanted stuff added to it, right? It's been a month now. We've seen Georgia release a school report. We still haven't seen Florida's report yet. When will that be released?
So I don't know that Florida has a report. I told them to work on it. I know they are. But
We know there is. They said that they were fixing their faults. When is that going to be released?
Okay. Well, I hope. Well, no. That was, I think, when that was put out. I mean, I didn't know that was even going on or whatever. But yeah, I would like to get out. You know why? Because the story is a good story to tell. I mean, even the Washington Post did a thing saying school openings have not caused any major change in coronavirus. Even USA Today admitted Florida has gone. You haven't seen it. And that's not something that was unexpected for me. I had a round table with some scientists the other day. One of them was Jay Bhattacharya from Stanford Medical. Jay testified in this lawsuit against the teachers union. And the amount of literature and evidence that had accumulated by the time we started moving to do this in July was huge in terms of the lack of transmission from teacher or from student to teacher, lack of even transmission amongst other students. And then the fact that it really doesn't have a huge impact on community spread either way, we were confident that this was going to be good. We also knew our numbers were going to go down from July, and so people were a little, we were like, Pinellas was probably under 10, but a lot of these communities were 8, 10, 11% positive, so they were a little worried. We knew that was going to go down, so by the time everyone got in, most of these things were 4 to 6% range, and Broward, incidentally, has been like 3%. Dade has been, I think they may be 5 or 6 today, but they've been in the 4s lately. So, so you see all that. So I think it's a good story to tell. Quite frankly, it should not have ever been political, and it should have been guided by this data. But what's happened across the country is exactly what happened in Europe. It's exactly what has happened in other parts of the world. And so I want them to give you whatever you can, whatever we can. What I also would like to do.
Will you push for it to be released, because it's been a month now? Will you push the Department of Health?
Yeah, but I just want I want to be clear. I'm not sure that was a viable product ever. I think they may have gone back to the well and have done some stuff. But yeah, I think we should do it. I mean, I think it's, and a lot of the counties do it, because they actually know better than us. When the positive tests come in, it just gets pumped into a system. We may know the person's 14, but we can't necessarily say they go to a certain high school or whatever. But yeah, I think it's really reassuring, and I think the thing that parents have done is whatever percentage started online, that goes down after kids go in, and then they're confident that things are going well. And I think you've seen that not just with the school districts. I think you've seen it with the private schools. I think you've seen it with the charter schools. I think it's been across the board. And then even our colleges and universities, I mean, we got a significant bulk of our cases each day come from either Alachua, Leon, some of it Hillsborough, USF. These are the college students that are testing. And but I don't know that we've had any significant clinical outcomes of all those quote unquote cases. And so I think it's certainly more prevalent amongst the college kids, because as you get older, seems to be that you're a more efficient transmitter compared to someone who may be in 5th grade. But even that said, the clinical results I think have been, I don't know that there have been any clinical results. So I think that's really important as we look at this stuff and as you look at different cases. Even if there were to be an outbreak at like a middle school or something, and you report that, which I know you're going to do, the question is, maybe a week later or 10 days later, did any of them actually get sick? Did any of them need any medical attention? And I think the answer almost always is no, that they didn't do it. And that goes back to how we're focusing on the folks who are the most at risk for this. Not that you want anyone to get it, but we really want to keep it away from the folks that are going to have a higher chance of bad clinical outcomes. Although even with that, I would say the outcomes have gotten better as the disease has progressed. I think the physicians have done a good job. There was actually a report out of Ocala, Advent, about they did some type of cocktail with steroids, some other stuff, and they had no ICU admissions of everyone they gave it to early. So now they're going to put that in kind of I think a clinical type trial. But there's all kind of innovation being done, and that's really, really exciting. This is going to be something that's going to help us. We're going to get it done as efficiently as possible. We hope to be able to have the requisite waiver so that we don't need to burden all the nurses. Quite frankly, this isn't a good use of a nurse's time because they have other things that they need to be doing as well. So we're going to work really hard on this, but this is significant. I've been frustrated with how the testing has gone, because as we seem like anytime we did something, then there would be something that would happen. Maybe the labs are backed up, maybe this, maybe that. This is probably as happy as I've been about testing in an awful long time. And to get this amount of tests, when you talk about 6.4 million, that's on top of the one, right? That's just to us. So all the long-term care, they're getting all these tests, and then we're getting 6.4 million on top of that. So it's going to be good. It'll be a good tool, and we'll continue to use it, protect our most vulnerable